Hello, everyone. My name is Dr. James Nez, and I'm 83 years old. I'm a cardiologist with a deep focus on heart and blood vessel diseases, and I'm honored to be a member of the Navajo Nation. For 43 years, I've dedicated my life to serving patients in my clinic, meeting people from all walks of life with stories that have shaped my understanding of health. When I started as a young doctor, filled with boundless energy and optimism, I believed I could conquer every illness with the right treatment. But as the decades passed, I came to a profound realization: preventing disease is far more powerful than simply treating it. This insight is especially critical for our elders in their 60s, 70s, and 80s, who often face unique health challenges. I've learned that every small symptom, whether it's a twinge, an ache, or discomfort, is a message from the body, a signal that something may be out of balance. Ignoring these signs can lead to serious health problems down the road, which is why I'm so passionate about prevention. Lately, I've felt a strong calling to share healthy living practices with as many people as possible, extending beyond the walls of my hospital clinic. My goal is to empower our community, particularly our elders, with practical tools to maintain their health right in the comfort of their homes. That's why I'm creating these videos, drawing on my 43 years of medical expertise, personal experiences, and the wisdom I've gained from both Western medicine and Navajo traditions. Today, we're addressing a common issue that affects so many of us, especially at night: leg cramps. That sudden, sharp pain when your calf muscle tightens is unlike anything else. If you haven't experienced it, it's hard to fathom just how intense and disruptive it can be. I began dealing with leg cramps in my 70s, and believe me, they were truly debilitating. But through a fortunate discovery, I learned a simple 3-second acupressure technique that provides immediate relief. Since adopting this method, I rarely wake up with leg cramps anymore. By the end of this video, you'll learn this effective technique, and I'm confident it can transform your nights as it has mine. When I first started experiencing leg cramps, I assumed they were an inevitable part of aging. Around the age of 75, one cold winter night, my calf muscles suddenly hardened, feeling like rocks under my skin. The pain was excruciating, striking once or twice a week at first. As time went on, the frequency increased, particularly during colder months when I'd suffer cramps nearly every night. It wasn't just my calves; my toes, thighs, and even the arches of my feet would seize up, causing unbearable discomfort. The worst part was the toll it took on my sleep. I became so afraid of cramping that I'd contort my body, bending my legs awkwardly to sleep, or resort to sitting upright in a chair for most of the night. My wife, Sarah, grew deeply concerned and urged me to seek help at the hospital. But as a doctor, I was stubborn, thinking, "I've studied medicine for decades, what could I possibly not know?" So, I tried to push through the pain, convincing myself it was just a phase. Then, one night, I experienced a cramp so severe it shook me to my core. My calf muscle twisted violently, my toes went numb, and I was sweating profusely from the intensity of the pain. That was the moment I realized this wasn't just a normal part of getting older, it was something more serious. The very next day, I ordered a comprehensive blood test. The results revealed that my magnesium and potassium levels were significantly lower than normal. I also underwent a lower extremity vascular ultrasound, which showed that my blood flow had slowed compared to earlier years. That's when it hit me: leg cramps weren't just random muscle spasms. They were a clear sign of an imbalance in my entire system, a warning that my body needed attention. Are you losing sleep because of nighttime leg cramps? If so, I believe the story I'm about to share will resonate with you and offer hope. I was able to overcome my leg cramps thanks to a fortunate encounter with one of my patients, an 88-year-old woman named Mrs. Agnes Whitehorse. Mrs. Whitehorse was a traditional Navajo weaver, a keeper of our cultural heritage, who had been managing arthritis for many years. She also worked with a traditional Navajo healer, blending ancient wisdom with her medical care. During one of her appointments, she noticed me limping slightly as I moved around the exam room. With a knowing smile, she asked, "Doctor, do you get leg cramps at night?" I was honest with her and admitted that I did, confessing how much they were affecting my life. She shared that she used to suffer from the same issue but had discovered a point on her calf that, when pressed for about 3 seconds, brought immediate relief. At first, I was skeptical. As a physician trained in Western medicine, I questioned whether there was any scientific basis for this approach. But that night, when another cramp struck, I decided to give Mrs. Whitehorse's method a try. I found the spot on the back of my calf, where there's a natural indentation between the muscles, and pressed firmly with my thumb. To my astonishment, the pain vanished in less than 3 seconds. I thought it might be a one-time fluke, but I tried it every time a cramp hit, and it worked consistently, night after night. Intrigued, I dove into research about this point. In the Navajo medicine system, there are many recognized points for pain relief, each with a specific purpose. Modern medical studies also support that stimulating this area can enhance blood flow, reduce muscle tension, and promote relaxation in the affected muscles. This experience was a turning point for me. It taught me that Western medicine and traditional Navajo healing are not opposing forces. They can complement each other beautifully. Any method that promotes health and well-being, whether rooted in science or tradition, is valuable. Now I share this acupressure technique with my patients, and I'm thrilled to share it with you today. If you find this video helpful, please consider subscribing and liking it. Your support will help spread this knowledge to more people, especially our elders, who deserve to live comfortably and healthily in their later years. Let's dive deeper into the real causes of leg cramps. Many people assume they're simply a result of aging, but the truth is far more complex. Several factors contribute to leg cramps, and understanding them is the first step toward prevention. The primary cause is an electrolyte imbalance. For our muscles to contract and relax smoothly, electrolytes like sodium, potassium, calcium, and magnesium must be in perfect balance. As we age, our kidney function naturally declines, and changes in diet or medications can disrupt this delicate equilibrium. For example, certain medications, like diuretics, can deplete essential minerals, throwing off the balance needed for healthy muscle function. The second major factor is impaired blood circulation. After the age of 70, blood vessels lose some of their elasticity, leading to reduced blood flow, particularly in the legs, which are the farthest from the heart. When muscles don't receive enough oxygen and nutrients, they become prone to cramping, even with minimal activity. The third factor is dehydration. As we grow older, our sense of thirst diminishes, so we often drink less water than our bodies need. When the body is dehydrated, blood becomes thicker, and muscles become more rigid, increasing the likelihood of cramps. I had a patient, Mr. Charlie Yazzie, 79 years old, who experienced calf cramps every night at 2 a.m. The timing was so precise that I jokingly said he had an internal clock ticking in his body. After a thorough conversation, I learned he was taking high blood pressure medication and diuretics, which caused significant potassium loss. He also drank very little water, rarely consumed soups or broths with dinner, and wasn't eating many nutrient-rich foods. Blood tests confirmed low potassium and magnesium levels, along with signs of dehydration. I adjusted his medication regimen, recommended he drink approximately 1,500 milliliters of water daily in small, manageable sips, and advised incorporating potassium-rich foods like bananas, potatoes, spinach, and avocados into his diet. I also suggested light stretching exercises about 2 hours before bed to promote circulation. When Mr. Yazzie returned 3 weeks later, he looked like a completely different person. "Doctor," he said with a grin, "I haven't had a cramp in a week. I'm sleeping so soundly, I can't remember the last time I felt this rested and refreshed." Leg cramps may seem like a minor inconvenience, but they're a clear signal of deeper imbalances in the body. Don't just endure them, take action to address the root cause. If you experience cramps more than 3 times a week, it's not a temporary issue. I strongly recommend getting a blood test to check your electrolyte levels, particularly magnesium and potassium. In my experience, magnesium deficiency is one of the most common culprits behind leg cramps. You should also review the medications you're taking. Diuretics and high blood pressure medications can deplete potassium, while blood sugar regulators or cholesterol-lowering drugs may also contribute to muscle cramps. If you're on any of these medications, consult your doctor about the possibility of adding electrolyte supplements to your routine. Take a moment to reflect. Are you drinking enough water each day? Do you consume a lot of salty or processed foods? These seemingly small habits can accumulate over time and trigger leg cramps, especially in older adults. Now, let's explore the 3-second acupressure method that I've personally tested and found to be remarkably effective. This technique is simple yet incredibly powerful. The Qingshan point is located on the back of your calf, where the gastrocnemius and soleus muscles meet, forming a natural indentation. To find it, sit in a comfortable chair, place one leg over the opposite knee, and raise your toes as if you're standing on tiptoes. You'll notice a slight hollow on the back of your calf. That's the spot. Using your thumb, press firmly on this point for 3 seconds while exhaling slowly, then release the pressure while inhaling. Repeat this process 3 times for each leg, alternating sides. This method relaxes the muscles, eases tension, and boosts blood flow to the area. From a modern medical perspective, this point is significant because it involves the gastrocnemius nerve and the posterior tibial nerve, which play key roles in muscle function and circulation. One of my patients, Mrs. Clara Begay, 74 years old, suffered from severe insomnia due to nighttime leg cramps. She was waking up multiple times a night, leaving her exhausted and unable to enjoy her daily activities. When I first introduced her to the acupressure method, she was doubtful, asking, "Can something so simple really make a difference?" But she agreed to give it a try that night. A week later, Mrs. Begay returned with a radiant smile. "Doctor, it's incredible," she said. "When I feel a cramp starting, I press that spot, and the pain disappears almost instantly. I can finally sleep without fear of cramps. Thank you so much." 3 weeks later, she reported even more remarkable results. "I haven't had a cramp at all lately. I press the Qingshan point every night before bed, and it seems to prevent them from happening." Research backs this up. A study showed that individuals who practiced Qingshan acupressure for 3 weeks experienced a 15% increase in lower limb blood flow compared to those who didn't, demonstrating that this technique not only relieves pain but also fundamentally improves circulation. When applying acupressure, pay close attention to the direction of pressure. Press slightly upward toward the heart to support venous return, which enhances the technique's effectiveness. Keep your fingernails trimmed to avoid irritating or damaging your skin, and don't press too hard, as excessive force can cause muscle tension. Pregnant women or individuals with varicose veins or thrombosis in the lower limbs should consult a doctor before trying this method. If you're watching this and wondering if you can find the Qingshan point, don't worry, it's easier than it sounds. With a little practice, you'll locate it effortlessly. The third critical aspect is daily management to prevent leg cramps from occurring in the first place. No matter how effective emergency treatments like acupressure are, prevention is always the best approach. First and foremost, prioritize water intake. Aim to drink 1,500 to 2,000 milliliters of water daily, but don't chug it all at once. Sip small amounts throughout the day to keep your body hydrated. Drinking a cup of warm water about 2 hours before bed can be particularly beneficial. Diet is equally important. Continue eating foods rich in potassium, such as bananas, potatoes, spinach, avocados, and sweet potatoes, and include magnesium-rich foods like nuts, tofu, brown rice, and leafy greens. On the other hand, try to reduce salty or processed foods, as excessive sodium can disrupt electrolyte balance and contribute to cramps. Your sleeping environment plays a significant role too. A quilt that's too heavy can put pressure on your legs, restricting blood flow. Sleeping with your toes pointed downward for extended periods keeps your calf muscles in a contracted state, increasing the likelihood of cramps. Instead, place a low pillow or cushion under your feet to slightly elevate your legs, which promotes circulation and keeps your muscles relaxed. I had a patient who left a lasting impression on me, Mr. Sam Tsosi, 81 years old. Mr. Tsosi was a former farmer with strong leg muscles developed from years of hard physical labor. But since turning 75, he had been suffering from leg cramps nearly every night, disrupting his sleep and quality of life. After observing him closely, I discovered he slept on a hard floor, a habit from his youth, and used a very thick quilt that weighed heavily on his legs. His biggest issue was his sleeping position. He slept on his stomach with his toes hanging off the edge of the bed, pointing downward, which kept his calf muscles contracted for 6 to 8 hours each night. I advised him to change his sleeping position, recommending he sleep on his side with a pillow between his knees for alignment, another under his head for comfort, and a low cushion under his feet to elevate them slightly. Changing lifelong habits was challenging, but the pain of his cramps motivated him to try. When he returned 2 weeks later, he was thrilled. "Doctor," he said, "just changing my sleeping position has already cut my cramps in half. I'm sleeping better already." A month later, with increased water intake, dietary adjustments, and the new sleeping position, his leg cramps had almost disappeared entirely. He was sleeping soundly through the night, and felt more energetic and engaged during the day. Light exercise is another powerful tool for preventing leg cramps. Dedicate about 5 minutes before bed to simple calf stretches. For example, stand with your hands against a wall and stretch your Achilles tendon by leaning forward, or sit down and pull your toes toward your body to stretch your calves. One particularly effective exercise is to lie down, place your legs up against a wall at a 90-degree angle, and slowly move your ankles up and down for about 3 minutes. This movement significantly improves blood circulation in your calf muscles, reducing the risk of cramps. Massage can also be a great preventive measure. After a shower, apply a small amount of body oil or lotion and gently massage your calves from the bottom up toward the heart. Use light pressure to avoid tensing the muscles, and focus on promoting blood flow. Take a moment to assess your bedroom environment. Is your quilt too heavy, pressing down on your legs? Are your feet in an awkward position that might strain your muscles? Based on my 43 years of experience as a doctor and my own personal journey with leg cramps, I've shared this comprehensive solution to help you find relief. The 3-second Qingshan acupressure technique can free you from the pain of leg cramps, as it has for me and countless patients. Let's summarize the key points to ensure you can apply them effectively. First, rethink the causes of leg cramps. They're not simply a matter of age. Electrolyte imbalances, impaired blood circulation, and dehydration are the primary drivers. If you experience cramps more than 3 times a week, it's a sign to take action. Get a blood test to check your magnesium and potassium levels, and review your medications with your doctor. Second, master the 3-second acupressure method at the Qingshan point. Press firmly with your thumb for 3 seconds, exhaling slowly and pushing slightly upward toward the heart. Practice this not only when cramps occur but also once or twice daily as a preventive measure. Third, focus on daily management to stop cramps before they start. Drink 1,500 to 2,000 milliliters of water daily in small sips. Eat foods rich in potassium and magnesium like bananas, spinach, nuts, and tofu, and optimize your sleeping environment with a light quilt and a low pillow under your feet. Incorporate 5 minutes of calf stretches before bed, such as the Achilles tendon stretch or the legs up the wall exercise, to keep your muscles relaxed and promote circulation. You might be wondering if these simple methods will really make a difference. I had the same doubts when I first learned about the acupressure technique, but I encourage you to try them for yourself. You'll be amazed at the results. Patients like Mr. Yazzie, who suffered from predictable nightly cramps, Mrs. Begay, who lived in fear of cramps disrupting her sleep, and Mr. Tsosi, who struggled to change lifelong habits, have all experienced life-changing improvements through these methods. The key is to start today, even if it's with small steps. Don't aim for perfection. Begin tonight by drinking 1 extra glass of water. Tomorrow night, try the Qingshan acupressure point. The day after, add some simple stretches, and then take a look at your sleeping environment. If you take these steps one by one, you'll find a healthier, more comfortable version of yourself in just a month. Sound sleep at night paves the way for more energetic, fulfilling days. Don't let the inconveniences of aging define your life or limit your potential. At 83, I practice these health methods every day, and they allow me to live an active, vibrant life. It's never too late to take control of your health. Starting tonight at 10 p.m., try checking the Qingshan point, adjust your sleeping environment to make it more conducive to rest, and drink a bit more water, even if it's just a small glass. Health isn't built in a day or two, it's the result of small, consistent practices that add up over time. I hope you won't give up on these methods after trying them once or twice but will commit to making them part of your daily routine. In my next video, I'll discuss the challenge of waking up frequently at night and share 3 golden rules for achieving restful, restorative sleep, which is the foundation of a healthy life. When combined with the leg cramp solutions you've learned today, these tips can help you enjoy more comfortable, rejuvenating nights. If you found this video helpful, please subscribe and like it. Your support helps me share valuable health information with more elders in our community and beyond. Your small act of care is a tremendous strength to me and the driving force behind creating better, more impactful content. Thank you for listening, and I look forward to continuing this journey toward better health together.